Non-surgical treatment for pilonidal sinus is the most desirable and searched for option for this common condition. Unfortunately, pilonidal sinus, though it may look very small, will require some kind of a surgical intervention. Now, how we can minimize the intervention in terms of recovery, rest, and away from studies, if I may say, because most of these people or children who are suffering from this disease are in the age group of 15 to 30 years of age. So they are otherwise actively involved in attending classes, giving exams, they have pressing issues, or they are working in companies where they have timelines to follow and they can't afford to be away from work for a long time. I am Dr. Nitish Jhawar. I am working as a laparoscopic and robotic surgeon at Apollo Hospitals Navi Mumbai. Pilonidal sinus starts with a small hole in the lower back, and usually it will just give little discomfort, a pus discharge, or a soiling of the undergarments, which may not be taken very seriously in the beginning. Now, if you delay diagnosing this particular problem, then sometimes it may end up in a large collection of pus, which we call as pilonidal sinus abscess, or a sterile collection, which is called as pilonidal cyst. But either which ways is going to complicate a simple disease. So as I said in the beginning, first and foremost thing, if you see that there is a small boil-like thing which is discharging some pus-like discharge or soiling the clothes, please go and see your doctor, because this is one area which you can't examine yourself, and if somebody else also is seeing it in the family, they won't be able to come to a diagnosis in this case. Now we have spectrum of treatment options for treating pilonidal sinus. If we treat or diagnose the problem early in the course of disease, then we have options of doing non-invasive surgeries or minimally invasive surgeries, including laser. Now, laser in today's time is the best option available for treating pilonidal sinus. So much so that we may not even call it a surgery, because we are just ablating a tract using a laser fiber without making big openings in that area. If you look at the postoperative period, the healing is much faster. The patient can go home on the same day of surgery. In 99% of the cases, it is done in local anesthesia. And all these patients who are otherwise young, who have exams coming up, some tuitions going on, or travel involved, they don't have to be away from work at all. Now, if we don't treat this problem in early course of the disease, then the other options which are there are quite demanding in terms of healing. We have different type of flaps which we do. The flaps like Limburg, rhomboid, Karadecki, D flaps, but all these flaps will require long hospitalization and rest at home in the tune of 2 to 3 weeks. There are some drains which are coming out to drain the postoperative wound, and still the chances of recurrence, if not nil, are there. So in today's time, if you diagnose a pilonidal sinus early, laser treatment is one of the best treatment which is available for treating this particular disease. So my strong recommendation is, if you have any doubt that you may have this kind of a condition or your child may have this kind of a condition, it is better to consult your doctor as early as possible. Unfortunately, there is no non-surgical treatment for this particular problem, but there is an option between a very invasive surgery and not doing anything, which is laser ablation of the pilonidal sinus, which is one of the best ways of treating pilonidal sinus today. Thank you.